Hi, my name's Ethan. I had the gastric sleeve done about a week and a half ago. I'm sorry if the audio and video quality on this is bad. I'm doing it from my phone. I'm doing this video to try to help people, hopefully. There's a lot of information that I didn't know and I didn't get told. I had to learn it for myself, and I'm hoping that this video enlightens some people. First of all, I'm a big guy. Obvious. I'm 360 pounds. I'm trying to get healthier. This is obviously private for me. So, bear with me. This is my first time doing a video like this. I'm hoping I'll try to cover as much information as I possibly can. But this one's going to be brief, or semi-brief at least. Three major things. The pain after the surgery. It's a surgery. It's invasive, even though minimally invasive. I'll learn to talk here in a little bit, but still, it's a surgery. I was not ready for how much pain there actually was with this surgery. I like to think I have a pretty high tolerance to pain. I'm not trying to brag. I'm serious. I think I can handle it pretty well. But this surgery, I was not prepared. I was not prepared at all. There was a lot of pain. After the surgery, they'll have you walk. Even the first day, they'll have you walk. And the reason for that is, part of the reason it's hard to breathe after the surgery. They fill you full of air. Your body cavity, so they can see everything going around, so they don't cut up your extra insides. With you walking, it helps break up the gas and relieve pressure and whatnot. Another reason is blood clots in your legs. And with you walking, it helps both. And it's a very good idea to walk as much as you can. Even though it's very painful, it needs to be done. First time, they had me get up and walk at the hospital. I didn't make it 10 feet. I didn't even make it out of the hospital room. I barely made it to the door. It hurt so bad, I almost passed out. It took two nurses and my dad to get me back to the bed and laid down. And then about 40 minutes later, I had to get up and do it again. They're serious about you walking. If you don't, you will be in much more pain than you already are. And trust me, there's quite a bit of it. I wasn't prepared for that much pain. I know I've said that quite a few times. But it was nowhere near the level I thought it was going to be at. Be prepared for at least twice as much as you think there's going to be. And now to the breathing. After you have the surgery, I didn't know this until I was literally about to be cut open. It's hard to breathe. They fill you full of air. And it puts pressure on your lungs. Well, when I woke up, very hard to breathe. It felt like I couldn't breathe, and I started to panic. And that's not a good thing, after you've just been sliced open. It's not a good thing to panic and try to get up and crap like that. The doctor got me calmed down. They put me on oxygen. Everything's hunky-dory. Well, they had me on oxygen, I think, 6, maybe 7 hours before I was released. And when you're being released to get released from the hospital, I should say, you have to walk and you have to be off of the oxygen. You have to be able to breathe by yourself. And they give you a little breathing treatment kind of thing, which I have. I'll show you. Some of you probably have already had to use this for different situations. I have before. I know the thing. I don't like them. But I would rather do that than get pneumonia. And that's why they have you do it, so your lungs expand and fluid does not collect. Just do what they say. It hurts. It sucks. But do what they say. You'll be much better off for it. With me, another thing, I actually figured this out researching. You want to bring a pillow. It sounds completely stupid, but trust me, you want to bring a pillow. Especially if you live a good distance away from the hospital. Like me, I live 2 hours away from where I had the surgery. Yeah, the pillow helped. The pillow helped a lot. Every time you cough, every time you sneeze, you're going to want that pillow. You want to hold it against you, just enough to hold down your stomach. You are going to want the thing. Trust me, if you do not have the pillow, you will be destroyed if you sneeze. I sneezed a few days ago and didn't get to it in time. Even now, a week and a half, being at home, destroyed me, just flat out. It hurt so bad I couldn't breathe, I couldn't move. All I could do was hold my stomach and wait for it to stop hurting enough where I could breathe normally. It was not an enjoyable experience. Coughing hurts, not quite as bad as sneezing, but still hurts. Even clearing your throat, just a little cough, you feel it. And the incision that is going to hurt the most is where they insert the tools. And that is most of the time on the left side of your body. I think. At least for me it was. They may have it on your right. But either way, that incision is going to be the one that is still causing you trouble. And when you get home, you're going to have to get up and walk quite a few times a day. Like every 2 or every 3 hours. But when you're at home, you get to sleep. So it's just during the day. So I'd recommend for the first 3 days, every 2 hours. And the thing with that is I'm going to explain the getting up and down sucks. Like, I can deal with it now, but I still have pain. Like, I'm sitting up right now. And that is a big achievement. It's a small thing. But trust me, it's kind of big when you have the surgery. Getting up on your own, that's another big one. Just being able to sit down with no problem, that is another big one. Like, you'll see whenever you sit down like at a normal chair or even a couch, even a nice fluffy couch, you have to position yourself kind of weird to keep that incision in your stomach from hurting. It's hard to get used to, but it's one of those things. I was not told about that at all. It's another one of those things I had to wing. And if I'm running this video long or if I'm rambling, I apologize and tell me that in the comments. I'm trying to put as much information that can help you as possible. Something actually one of the nurses told me that very good information. This should be obvious, this should be common sense, but listen to your doctor. Don't try to do anything before he okays it. You're going to be on a liquid diet 2-3 weeks before you have this surgery. And you're going to be on a liquid diet probably just as long after. Just straight liquid diet. At least before, you could have one solid meal a day, except the day before the surgery you can only have liquids. Yeah, it's not fun. I'm sitting here going nuts, and even just for something simple. But I would rather sit here and go nuts than have happen to me what one of the nurses told me. There was this guy that decided that he was fine and he could eat solid food, or semi-solid food. And he got a couple of spoonfuls of yogurt. You're thinking, yogurt, that ain't no big deal. Soft food, you shouldn't have a problem with that at all. Wrong. This guy took 2 spoonfuls, just 2. No more, no less, 2 spoonfuls. Popped his stomach. Was in intensive care for a month and a half and had to have 2 major surgeries to repair the damage that had been done because of 2 spoonfuls of yogurt. If you ask me, that's not worth it. It's not. Another thing, thinking about this, with the pillow. If you were watching something funny, like a comedy show, or like America's Funniest Home Videos, or Ridiculousness, or World's Dumbest Criminals, crap like that you know you're probably going to laugh in, keep that pillow tight on you, because one good laugh will do the same thing as like a coughing or sneezing. It hurts so bad. Like now I can laugh some without having to worry about it, but for the first few days, like I went to visit one of my friends, and we always cut up. Always. We always just spurt off the most random crap of all time to make each other laugh. Well, I was crying. Not from it being so funny, from pain after that. And one thing that you'll notice, when you get up and down, it's hard to stay stood up for a while. Like I can do it for about 20-25 minutes at a time. And the more you get up, the more you walk, the better it'll be. Stuff like that. And like I said, I'm probably rambling and not giving much information, and I'm sorry for that if I am. If there's any questions you have, feel free to put them in the comments. Like I said, be careful. Another one is the liquids. Be careful, don't overdo it with the liquids. Just a little sip every now and again is all you're going to need. You don't want to push it and mess up your stomach. It's very hard to stick to the liquids. Like I said, what I'll be able to eat now is a full meal I used to be able to do in 2 or 3 bites. And it's going to be very tough to get through that. But like I said, pillow, the route home, coughing, laughing, it's a must. The pain, always be ready for it. Pretty much, like I said, expect double what you're going to get. Or what you think that you're going to have. And the hard to breathe. Use that breathing treatment daily and often. Well, like I said, if you have any questions, put them in the comments. If I get a good response with this video, or if I get enough questions, I'll make another one. Hopefully this has helped somebody, and if it helps one person, the video is worth putting up to me. So, thanks for watching.